We've had a great day. We've talked about process, semantic, clinical interoperability. We've talked about governance. We've talked about data sharing agreements and electronic medication reconciliation. But we've also talked about patient safety, and we've talked about quality, and we've talked about failures. And, I'm not sure that we would have talked about that, even 2 years ago or 3 years ago. And I think Dr. Geiger really started off well this morning and talking about some of the things that were working well, and some of the things that aren't working well, frankly, in the system. Now, don't get me wrong, I don't think the Ottawa Hospital or any of us in the room are going to change the models to, our mission statement of the hospital is we want to suck less. But I think, we wouldn't have had this conversation, even a couple of years ago. And I was at a session even last week where they had a whole plenary session around failure. And I think one of the reasons for this is that the patient role is changing. Patients are taking a much more active role. We do a lot of public opinion research at Infoway, and we know that patients really care about the healthcare system. We all know that. We know that they really value their role in it and want to increasingly take a more active role. They want to be engaged members of their care. They don't want to be leading the care team, but they want to be an important part of the care team. They have access to information now with the democratization of knowledge that happens with the internet. They do go to Dr. Google and they do get information, and why wouldn't they? I mean, if someone tells me that there's something, I've got something, I'm going to research it as much as I can. I really want to understand it. And they have access to technology and tools. And we know that Canadians, through our research, want 4 things. They want the convenience of being able to book appointments online. They want to be able to access their own information. They want to renew prescriptions online. They want to do teleconsults with their physicians. How many people in this room have a Fitbit or use an app to control chronic disease or running or recipe or exercise or anything? 1? Oh, there, good, okay. I'm talking too fast, it takes time to catch up. Got it, okay. So, we're using the tools and we're using the technology, and it's important to us, and we want to continue to do that. And so, and I think, the other thing is social media and other channels are really giving patients a voice. We have Patients Canada, we have patient advocacy groups that we didn't have a few years ago. And, one of the things I'm going to talk about is our public education campaign, and the patient voices, and Judith and Cheryl are 2 of our patient storytellers that are featured in our campaign, and we found them. Cheryl in particular is a blogger and through social media, and we have e-patient Dave, everyone's heard of, giving my damn data is his motto, and we have nothing about me without me, and those kinds of sessions. So it's really making a difference. And so I want to talk about that in the context of our public education campaign. We launched it 2 years ago, Better Health Together, and it was really to create awareness and support for digital health among Canadians. And we know Canadians understand clearly the benefits of electronic health records. They understand how it can be used to help them in an emergency situation. They want the access, the convenience that it allows. But they also, when we did focus groups, it was first of all, and I think Dr. Osford referred to this morning, it's well, doesn't that exist already? Or the other comment was, what's going to happen, it's inevitable. So I'm not necessarily going to go out in the streets and march for it, because it's just a matter of time that we will have electronic health records. And so that was the impetus for launching the campaign. 3 components to the campaign. One was the creative. We've got 1 TV and 1 digital ad and 3 other digital ads only that are running online. How many have seen them? I'll give you a hint. Here, there, and everywhere. If that jingle rings a bell to you, you have seen our ads. So the motto of the ad is, do you think digital health isn't making a difference? Think again. And it's really to get people thinking about the benefits of digital health and the solutions that they are offering. And Cheryl and Judith will tell their patient stories around how that works. The second component of the campaign was around relationships, and I'll talk a little bit more about that. And then multi-channel amplification. We've got a very strong social media, digital, online, public relations campaign, and that's been very, very helpful. Again, I've got lots of statistics. In terms of the relationship side, we have every single jurisdiction in Canada is supporting this campaign, including Health Canada. We didn't always get that, and we haven't gotten that for a long time. So that's a clear signal to people how important this is. We have supporting organizations. Look at the supporting organizations nationally that are involved in this campaign, and I mean engaged in this campaign. We had Digital Health Week, November 10th to 14th. Many of you will have experienced that. And all of these folks, clinical groups, patient advocacy groups, disease-specific groups, the industry groups, all came together to support this one initiative. So that's really, really telling about how much support there is for doing this. Digital health, they all understand it. But the most important component of the campaign is around stories. And so it's really about patients telling their stories about how digital health has positively impacted them. And I was at a session last week, and Dr. Mike Evans, who many of you might know, runs a lab out of St. Mike's Hospital, and they know through what they're doing is data is important, and we certainly heard that in spades, and we know that. But stories trump data every time. So to hear a patient's story, and we can say 99% of hospitals have imaging in Canada. Well, that's very interesting. But then to hear, and for those of you who are at Dr. Law's session, in the last session, talking about the patient story associated with digital imaging, it's much more impactful. And to hear the stories from the patients, our previous CEO was talking to the Economic Club, and we had written these stories out because we didn't have time to play these 3 or 4 minute videos of all these patients. And then he actually saw the videos, and he called me into his office and he said, these videos are really good. And so I can talk to them, but you got to see it from the patient's perspective. They're really good. So we created this video. And so I will just play you the video. We've got storytellers from across the country. We've got them not only Canadians and patients, but clinicians as well, talking about, again, the benefits that have accrued to them specifically around digital health. I'll play you this 2-minute video, and then I'm not really going to introduce Cheryl and Judy, just to say that they are patients, storytellers that have been gracious enough for 2 years to be advocates on our behalf to talk about this. They will introduce themselves and tell you their stories, so you'll hear it from the horse's mouth. I think this is a great way to end the day, to end the session, because you got to do the data governance, you got to do the interoperability, you got to do the grind, but every once in a while I think it's nice to come back and say, remember, this is why we're doing it, and we're all patients. So let me play you the video, and then Cheryl will speak, and Judith will end the session.
Digital health records have been able to empower and keep my family in the loop effectively from the first day that I found out I had cancer.
Digital health has made a positive impact on my life by my doctor using the electronic medical records. It makes it easier for him to order the prescriptions. I don't have to get a prescription from him. It goes directly to the pharmacist, and when I get to the pharmacy, my prescription is ready.
This experience has had an immense positive effect on our family. I know that at a moment's notice, I can email my daughter's doctor that isn't affiliated with the rehabilitation hospital that she attends, and get pretty prompt answers from him.
I think basically what digital health has done to my life is it's sort of empowered me to become a partner with my doctor, rather than just being a doctor-patient situation where I'm down here and she's up there. I now feel that we're on a level and that we're working together towards my health.
When people get used to, because they're used to the internet and they get used to digital health, they're going to say, oh wow, where was this before?
So this is my family, and I'm Cheryl, and I am a stay-at-home mom right now to 2 beautiful little girls, Lauren, who will be 8 in January, and Jillian, who just turned 6. Jillian received a diagnosis of spastic diplegia cerebral palsy at 13 months old. And so I'll tell you a little bit about our story and how I became involved in digital health. My husband's also pictured, not pictured as our cat and our new puppy. I was clearly not thinking when I said that we would get a puppy. So our story. Imagine that you're a young mom. I was very fortunate to be young and have a child, but there are many different things that happen in our life that we don't really expect. It was a dark and stormy night. No, not really, but it always sounds better if you start that way. It was a very hot day in September in Toronto. We're not from here, we're from Nova Scotia. So I have no family and friends here. I feel that that's really important to explain. My daughter Jillian was born on September the 8th, 2008, at 30 weeks gestation, after 4 days of premature rupture of membranes. So you might wonder why this is important to my story. When you go and see a new clinic, when you have a daughter that has a disability or has special needs or is premature, you must give this story over and over and over. And I can tell you that I have given this story as many as 4 times in one day. I now make a joke. I have it down to 10 minutes. I won't bore you with all the boring details. But she was born September the 8th, 2008, 11:04 p.m. or a.m. in the morning. And I had spent 4 days in Trendelenburg waiting, hoping that she would stay. She had other plans, so she came 30 weeks, 1622 grams, 3 pounds, 9 ounces, if you don't know the conversion. And this is all things that I needed to immerse myself with every single clinic I went to. When I'm giving this history, the med student, the fellow, the resident, whoever's talking to me will say, well, how was your previous pregnancy? Well, it was fine, thank you very much. Did you drink or do drugs during your pregnancy? No, I did not. And for me, I know realistically that it was not my fault that my water broke 4 days early or at 30 weeks. But emotionally, I don't think I'll ever get past that. So while telling our story over and over and over again, this is just a way to reiterate what has gone on in her very short life so far of 6 years. So the first picture is our first family picture, taken, she was 2 weeks old at that point. The bottom one is 10 minutes after birth, and then it just goes right around until her first birthday. She came home a very tiny Thanksgiving turkey on Thanksgiving Monday. They called us from the NICU, and they never called us because I would call them first and see how her night was and see how everything was. And they'd say, she's fine. But they called us, and my husband got to the phone first, and he's not really great at relaying information when it's happening. So all I heard was, yeah, that's good. I'm wondering, who is it? Who's calling us at 8 o'clock in the morning? And he just whispers, it's the NICU. And when you have a child in the NICU, you don't want to hear that because you think, oh my God, what happened? What do I need to do? How do I prepare? But instead, they were asking if we'd like to take our underbaked, under 5-pound turkey home on Thanksgiving Monday. And we did, and she rounded out our family. So I am fortunate to have a really unique perspective that I right now volunteer with Holland Bloorview Kids Rehabilitation Hospital. If you're from the Toronto area and you don't know where that is, you'd be surprised, many people don't. It's actually right beside Sunnybrook, or right behind the CNIB in front of the Toronto Rehab Center. I started this journey with Holland Bloorview in January of 2011, when I finally got comfortable enough of telling our story over and over and over, and leaving my expertise with somebody else without breaking down into tears, which some days still doesn't happen. My daughter has actually presented now for the quality committee of the board at Holland Bloorview, and she says, and I've never been asked to do that committee, she said, but Mom, I'm so nervous. And I said, I get nervous every single time I tell our story because it's something personal to me. And if there's a time that it's not personal and it doesn't bother me, I need to stop doing it. So my first committee involvement was with the Electronic Health Record Steering Committee, which was a small, intimate group of people. And we all sat around a table, and right across was Jillian's main doctor for her cerebral palsy. And this is before we had met her in clinic, and I was like, oh no, she's gonna think I'm one of those moms that have to push everything and have ideas and want to influence change. But thankfully she didn't. She thought that I had good points, which is nice to hear. So then, after this small steering committee had formed, they had decided to make the electronic documentation change team. If you No Holland Bloorview or anything in healthcare, we are very, very fond of subcommittees, and we seem to have a subcommittee for everything. So with the electronic health record documentation change team, which is a huge mouthful, we talked with a member from every part of the hospital. So senior management team, OTs, PTs, physicians, radiology, anybody that might be in a child's care. We had someone from that area of the hospital. And getting all of our schedules to really mesh was kind of difficult at some times. But it was really interesting that I went up and I said, "Do you have a family on this committee?" And they said, "Well, no. Why would we need a family?" I said, "Well, I use my daughter's chart more than anyone else will ever use her chart. There are very many different things that I'm going to need her chart for. So if you don't have a family, I would love to sit in." And I was nervous because this was a very large group of medical professionals, and at that time I wasn't all gung-ho about exactly knowing how to portray myself when I was just a mom. And that's exactly how I felt and how I would explain myself, is that I'm just a mom, which really isn't true because I do advocate very strongly for my daughter. So sitting around the table, we had many, many, many conversations about jargon. Now, I myself like to use jargon to show off because I am not a medical professional. So I like to say that my daughter has cerebral palsy secondary to periventricular leukomalacia, and I can spell it, and I can explain what it is. We actually just went to the brain exhibit at the Ontario Science Centre, and my daughter looks around, Jillian, who's in her wheelchair, and goes, "Didn't they clean up? Didn't they know we were coming?" Because there were wires all over the place explaining the brain pathways. So here I am, taking this opportunity and explaining exactly where the problems are with her brain. So that was interesting for my behalf. So I provided very valuable insight, at least that's what I'm told, towards our electronic health record. And I explained that there are many families that come to Holland Bloorview that cannot speak English or cannot speak English well. I would get 6-page documents that said that she had a strabismus. What the heck is that? So I would turn to Dr. Google. I know many medical professionals hate that, but when you're trying to figure out what's going on with your family, you need to know. So now we've trimmed it down. The jargon is less used, which is good. I know that it still has a place. And I'm now getting prompt reports, which is really important because we would get reports that were 6 to 8 weeks old by the time we got the report. And so all of the goals would have been totally void by that time. So our electronic health record went live on October the 31st, 2012, not without a lot of tears and hard work and many words like contemporaneously, and that clinicians were supposed to chart right at documentation and right when you meet the parent, and how do you include the family in what you're doing with this new piece of technology. And a funny story was that we just went to my daughter's IEP meeting, and her therapist had an iPad. And I'm like, "Oh, great, how's it working for you?" "I hate it." "Oh, okay, what's the problem?" So I explained that the co-chair of the Family Advisory Committee, we take your concerns really, really well, and I helped with this. What's the problem? "I can't find anything." And I said, "Well, okay, what screen are you looking on? Maybe I can help." So that provided me a different insight to what they're looking at, which is really actually quite interesting. So now, because of Canada Health Infoway and the Infoway Partnership Conference that was held last year in Halifax, Holland Bloorview has received an investment from Canada Health Infoway for a new patient portal, which is very, very, very exciting. And I actually had a big, huge, oh crap moment right before lunch. I thought my daughter had an appointment tomorrow. It was today, and I missed it. And I was furiously emailing, trying to get it figured out that maybe someone could grab her from school, they're at the same building, just grab her and take her. We've been on this wait list for 3 months. We had to change the date the first time because she was sick, and now I made the mistake. So with the patient portal, it's going to be very exciting that I won't make any more mistakes like that. So this is the first portal of its kind in Canada for children's rehabilitation. And the portal platform is built on Meditech because that's what our EHR is based on. I had a vendor last year in Halifax try to sell me their product, and I said, you need to talk to them over there because I don't know this end. But I can tell you from my standpoint, it's very user-friendly. The first test group is the Family Advisory Committee, and it will come to us. So I'm the co-chair of the Family Advisory Committee, and we have a membership of 33 parents that we will try the product and provide feedback and use it regularly starting December 2014, and the rest of the hospital. And within the first year, we're hoping to target 700 families within Home Bloorview to use it regularly by mid-2015 to the end of 2015. Thank you.
Hello, good afternoon. My name is Judy Morley, and I have the unenviable position of being the last one to speak before you go to the fair. Heaven knows there's probably cocktails there. Okay, my story. On Thursday, January 2008, I was diagnosed with rectal cancer during my first routine colonoscopy. I'd like to thank Dr. Peter Roscoe, who spoke earlier today, about his focus on colonoscopy. Trust me, I did not fall between the cracks. I have had so many, it's scary. The following Monday, a few days later, my husband Dave and I met with our oncology team at Sunnybrook to plan what would be our new lives for the foreseeable future. During that meeting, we were offered the choice of becoming part of the hospital's digital health program. Their electronic patient system was strongly focused on the patient. We elected to sign on. In the course of many years, it would become a tome. It was enormous. It included my medical history, all procedures, tests, appointments, all my surgeries, and best of all, the transcripts, or what seem to be called today e-notes, of each hospital visit. It also allowed me to provide additional information as needed with respect to any complications or concerns. We could either act in these points immediately, via phone or email, or we could wait till the next visit. Looking back, it was one of the best decisions Dave and I ever made, and would significantly alter how we reacted to our cancer journey. I have been asked today to say how digital health has impacted me. I've had a lot of time to consider this answer, and while I don't claim to be wiser, I feel that with time and experience, one does gain clarity. This is my low-tech answer to a high-tech proposal. The impact of digital health has changed over the course of my cancer journey. I see this as having 3 stages. 1, the initial stage, 2, the treatment stage, and finally 3, the post-treatment stage. In the initial stage, digital health represented hope. In the treatment stage, digital health represented empowerment. In the post-treatment stage, digital health represented ownership. We'll elaborate on each stage. The initial stage involved finding out very unexpectedly that I had cancer. It was major, it was advanced, and I was told that my life would change that day. Nothing would ever be the same again, and it isn't. My initial doctor visit a few days later at Sunnybrook, the assessments, grueling tests, which I hope you will never know about, multiple doctors, technicians, and services, and then a plan of treatment. The user of digital health at this stage was my family, the cancer team, and my family doctor. Given the shock factor, the addition of overwhelming amounts of information, tests, and teams involved, it was not possible to absorb much of the data on the spot. Digital health allowed my family time to review and assimilate the information at home, and where needed, contact a team or list items for clarification during our next visit. In hindsight, digital health gave my family hope. Before I left the house this morning, my husband just wanted to, since he hasn't edited my speech, he wanted to make sure that we understood that the user is the family at this initial stage. From my perspective as a patient, I was in shock, angry, grieving, and unable to even comprehend the value of digital health. I appreciated the comments from Ryan Magnuson on his point about opting in and opting out. When a person's life has been changed so dramatically and you're not sure if you're going to be alive in the near future or if you want to be alive, then issues of confidentiality and security are not even on the radar. So from my family's point of view, it was awesome to have all the information on hand anytime they wanted it, and also written by what the doctor said. The treatment stage, oh, this is great. 5 weeks of chemotherapy and radiation, followed by another long round of chemo for good measure. Countless blood tests. They loved their blood tests. Doctor's visits and multiple surgeries. The use of digital health was, again, my family, the cancer team, my family doctor, and me. Somewhere along this stage, I began to become involved in my treatment. In my case, it was about 9 months in. What can I say? I'm a slow learner. During this stage, my family and I felt empowered. We were not going along for the ride. We were now part of the plan. Digital health was especially valuable during doctor's visits, as time is short and we are all under tremendous stress, resulting in an overload of information and a loss of recall. Digital health provided the base to prioritize concerns during later visits. Later at home, it allowed us to review, make notes, look up Dr. Google, and answer questions or requests, asked to answer questions or request clarification. The final stage, post-treatment stage. Relief, elation, then terror. I'm cutting the umbilical cord. The user of digital health during this stage is me. My information is available to me anytime, online, anywhere, any place in the world. It allows for doctor-to-doctor communications. If any of you have had a major complicated health issue, you'll understand that most of the words are unpronounceable and certainly very difficult for me to explain to another professional. I can track on an ongoing basis all my well checkups, any procedures going forward, and appointments. Despite the shock, anger, and grief of the initial stage and the crazy stuff during the treatment stage, I find the hardest part is going on in life. I am no longer enveloped in a nice cocoon of family and a medical team. I am well. It is now up to me. I have taken ownership of my health care. That said, my claim was put to the test in 2011 when I became seriously ill while flying to Mexico. But that's another story. Next in life, I and my security blanket, digital health, will continue to travel knowing I have the security and assurance of being only a link away from my digital health. In closing, I would like to express my thanks to Dr. Calvin Law, who spoke earlier and was part of my oncology team at Sunnybrook during my cancer journey. Any questions or negative comments about this speech, you can refer to him. Thank you and good afternoon.